All right. Hello, everyone. Welcome to another virtual shadowing session at Hearts for Health. Today, we are joined by Dr. Monica, who is a cosmetic and general dentist. This is another one of our dental sessions. I know there's quite a few pre-dental students out there interested in these, so we're happy to offer them. A few reminders, because we know there's quite a few people joining in this season of virtual shadowing. Towards the end of each of these sessions, we will have a Q&A, so feel free to type in any questions you have in the chat. At the very end of our session, towards the last 15 to 20 minutes, we will go through those questions during the Q&A. Also, if you want to stay updated with future shadowing sessions, we have shadowing sessions across medicine, PA, dentistry, and a variety of other fields, hosting different speakers each time, different faces. To stay updated with those, either you can follow us on Instagram, where we post those flyers for each shadowing session. We also have announcements for programs outside of virtual shadowing. We have a few other programs, I think 3 now programs that we have out there: a mentorship program, a refugee teaching program, and a clinical volunteering program. If you're interested in any of them, feel free to go through the flyers, and they do have different cycles by semester, but that's some outside information. Another way to stay tuned with us is to join our email listserv, where we send out announcements for future shadowing sessions. It also includes those program announcements. So programs outside of virtual shadowing, those announcements are also included in our listserv. Both ways are great ways to keep in touch with us. So feel free to use either or both, whatever works for you. To join our listserv, you can either subscribe on our website. At the very bottom, there's a subscription form. So just enter your name and email and send it over, or you can directly email us at shadowing.h4h@gmail.com and ask to be added onto our listserv, and then you can go from there. Those are a few reminders I wanted to shout out, but outside of that, that's all. So Dr. Monica, feel free to take it away.
Hello, everyone. Thank you for watching. Please leave your questions in the chat, and I hope you guys like my presentation. So I'm going to go ahead and share my screen here. And let's see. There we go. Perfect. So I used to have an Instagram page called Dentistry by Dr. Monica, but it was so hard running 2 different pages. So I just kind of have streamlined everything into one page. I still have a few things on Dentistry by Dr. Monica, but if you need to contact me, or if you would like to, it is at the Classy Dr. Monica on Instagram. And I'm happy to answer any and all of your questions. I usually post my dentistry in my stories, not really on my page. So just FYI. A little bit of my background: I went to college at Dillard University in New Orleans. I'm originally from New Orleans. I went to dental school at Meharry Medical College. It is one of the 2 historically Black college universities that are responsible for the majority of minority physicians, dentists, researchers, things like that. So if you haven't heard of Meharry, please look it up. It's in Nashville, Tennessee. I did a general practice residency at Morristown Medical Center in Morristown, New Jersey, and I'm currently in private practice. So what do general dentists do? We do fillings, we do crowns, we do veneers, we do braces, we do extractions, including wisdom teeth. We do implants, and we do dentures. So we kind of do everything. Here is a case. Most of my presentation is cases. So if you, I know sometimes that it's cool when you have a presentation that's a lot of words, but I feel like you guys may benefit from looking at a lot of real world cases and what we see. So this is kind of what you see on a daily basis in the dental office. If you look, this patient doesn't have any posterior teeth. So you can kind of see what's going on with that. I think my slides might be out of order. Yeah, it skipped. So actually, this might be the wrong one. Oh, yep. Sorry. Let me not share my screen. If you can actually go to a question, that might be helpful for me. This one.
Yeah. One of the questions we have is about being a cosmetic and general dentist, more so about being a cosmetic dentist. Do you deal with a certain age group particularly, or do you just really see a whole array?
Yeah, so we do see an array of patients. You, as a general dentist, you can see children, you can see geriatric patients, which is like your older population, which mainly they have dentures, partials, things like that. You're really cleaning their appliances so they can have a better quality of health long-term in their life, because they really need their appliances to chew, to eat, to function, and, you know, to be healthy in the end of their, you know, as their life kind of like declines. So it is a big range. A lot of general dentists, what they'll do is kind of cater their practice to certain things. But as you get out in the real world, you'll see that once your patient trusts you and they like you, they don't really want to go anywhere else. So if you can provide the services to them as a general dentist, whether it's the root canal or taking their wisdom teeth out, not saying that you have to take out all wisdom teeth, but it's definitely worth looking into or considering the training so that you can provide those services to your patients. I'm going to go ahead and resume my screen share if I can. There we go. Sorry guys about that. And are we good with the screen share? Can you see that?
Perfect.
Perfect. Okay. So what do general dentists do? So it's kind of like, if you think about it, it can be a little bit overwhelming when you think about what general dentists do, because we do everything. And most of the time, this is what you're seeing with your patient. You're like, hi, how are you today? Like, you're so excited to give them this service. And then they're like, oh, I hate the dentist. And so this is your life. So get ready for it. I'm sure most of us hate the dentist ourselves. So this was another one, that previous slide. But at any rate, IV sedation dentistry, which is moderate conscious sedation. And that's why I'm here to chat with you today about what I do, offering all of those services that you saw on the previous slide, but under IV sedation, which is great. IV sedation dentistry, the moderate conscious sedation, is actually producing a twilight type of sleep while your patient gets dental work done. They can hear, if you command them to do something, you say, hey, bite your teeth together, Mr. Jones. They'll wake up and they'll bite their teeth together. You can check their bite. They're fine. What's so great about IV sedation dentistry is that the patient can maintain their airway. So when you're working on patients in dentistry, when you're working on their teeth, you need to keep the tooth cool, because if you overheat the tooth, the nerve in the tooth dies. So to keep the tooth cool, you need air and you need water. So can you imagine if you're using a handpiece that generates or pushes out air and water in the back of someone's mouth, and they can't control their airway, that will create a serious problem. So with the moderate conscious sedation, it works really well because that the patient can control their ability to swallow, and they're not at risk for choking when you're working on them. So it works really well. Most of the medicines we use are Versed and fentanyl. Fentanyl has a bad rep right now, but it's because people are abusing it. When you use it the right way, it's an amazing drug. It has a quick onset, quickly leaves your body when you use it in the right doses. This kind of just goes back to the amount of training that you have to do, because you obviously have to know how this drug works, what it affects, what patients you can and you cannot use it on, and how much, of course, you can use. Dexamethasone, ketorolac, Zofran, and those are either anti-nausea, steroids, or pain reliever drugs that we usually give to most patients on a daily basis when we're performing IV sedation in practice. You always obviously want to maintain their airway. So with that comes training about patient intubation. If there is an adverse situation or a reaction from a patient, which could always happen, you want to be able to maintain their airway so that they're able to breathe, that they're able to survive. So this comes along with IV sedation training. It is a training that you have to get after you finish dental school. Some people can receive this training in their residency if they are in a hospital setting. If not, you do have to take a ACLS course or a IV sedation course that offers ACLS training so that you're able to maintain the patient's airway. It's a requirement by law that you are not CPR certified, but ACLS, which is Advanced Cardiac Life Support. So it's a pretty serious thing, but so is dentistry. So it's nothing to be scared about. I think people say that dentists are not real doctors. But when you go to dental school, you're taking the exact same classes in the beginning that all the physicians are taking. But when you graduate from dental school, unlike the physicians, you don't have to go to a residency program. You can go out straight to private practice. Mind you, you may not have all the training that you need, but there are continued education courses that you can take for that. But you are totally equipped to be that doctor that you have trained for in your 4 years of dental school. So that is the awesome thing about dentistry. Also with dentistry, you see a problem comes into your office and you solve that problem and the patient goes away. Sometimes with medicine, and I'm not knocking it, but just giving you a different view of it. Sometimes with medicine, it's kind of a guess. They're treating symptoms. With dentistry, you're treating the exact problem. If a patient comes in, they have a toothache, you're either going to do a root canal, you're going to take the tooth out, you're going to stop that pain. You're not going to just give the patient some like an antibiotic and just say, well, we'll see how this goes. It's kind of an absolute science. So that's the awesome thing with dentistry. So if that's your thing, you may really want to consider a dentistry here. So what is the number one procedure that you think comes to mind when you think about sedation dentistry? And I'll pause. I'm pretty sure you've already got it there. This is a coffee before chaos because every day is chaos in everybody's life. Wisdom teeth extractions. So general dentists can do wisdom teeth extractions. You do have to have a certain skill level. There are really simple and easy wisdom teeth extractions that you can do on patients, and you can do the complicated ones as well. You just have to of course, be well-versed in that and have the level of experience that you need to have. As dentists, I think we always think it's cool to take pictures of everything we do, especially wisdom teeth extractions, because the bone and the body is so amazing at what you can get it to do, especially when you're taking out a body part, which is. So here you can see the teeth that are in the far right corners of each corner. Those are the wisdom teeth. And that's on the x-ray on the left side, and on the right side, this is how they look when we take them out. With dentistry and with any surgery, you always want to write down what you're doing. You always want to have a strategic plan and approach to whatever you're doing. And that just kind of ties into how you're studying, because I'm sure some of you guys are studying for DATs or whatever else. You want to always have a plan of what you're doing. If you don't have a plan, you're kind of planning to fail, or you're planning for something to potentially go wrong. So we always write down what we're doing, so we know, everybody knows, the assistant knows, and we're not just taking out whatever teeth, or sometimes we're distracted and we don't know, or we come in and our mind may be occupied somewhere else. So it's always great to have whatever you're doing written down. This is a cool picture of some cleaned off wisdom teeth. They're usually not that pretty, but they're all intact, all in shape. The reason why we take the pictures sometimes is for documentation purposes also. So when you take a tooth out, you want to make sure you've gotten the entire tooth and not just most of the tooth and no roots. So it also can serve as a documentation purpose in case a patient comes back and they're like, well, maybe I feel like there's something still there. Or you have the documentation, you can put in the patient's chart, hey, this is how your teeth looked, and this is exactly how they looked on the x-ray as well. So it's kind of something cool there that you can do. Here is more wisdom teeth. So when you do IV sedation, you can provide more services than just extracting the wisdom teeth. You can do a root canal and a crown on a tooth, and then you also can do a root canal, wisdom teeth extractions. So with IV sedation comes the opportunity for you to perform more comprehensive overall oral health care versus just one tooth at a time dentistry, which kind of can take a long time over the period of maybe a year or 2 years. So let's say the patient has insurance and their maximum amount is, whatever the cost, they can only do maybe one crown or maybe like a few fillings. With IV sedation, you provide your patient the opportunity to say, hey, I know your insurance only covers this, but here you will be able to get all of your healthcare plan taken care of. You will have a healthy mouth. You can move forward, and all you have to do for the next year or two or however long is coming for your cleanings. Most patients really want that because they don't want to continue to come to the dentist, because remember in that first 1 or 2 slides, everyone does not like going to the dentist. So the way you market sedation dentistry is you tell the patient, hey, do you not like the drill in your mouth? Do you not like the sound of it? Do you not like the smell of it? Do you want to just come in and get everything done and not have to come back except for your cleaning? These are all ways that you can market sedation dentistry in your practice, but it's also serving a great purpose to your patients, and a great service to your patients rather, because they can come in, you're actually giving them an opportunity to have a completely healthy mouth, as opposed to just getting one or two things done at a time. So more wisdom teeth. Most people have issues with wisdom teeth, so that you will see a lot of. And most patients don't really want to see an oral surgeon because oral surgeons sound scary. Or you've seen the YouTube videos of people going to the oral surgeon and they're kind of saying crazy things. With sedation dentistry, you have that maybe just a little bit, but most patients, it's because it's conscious sedation, they're more aware or more alert of what they're doing. Most of the time, if they're kind of talking out of turn or, kind of just saying weird things, it's usually right when they're about to go to sleep. So this is a picture of wisdom teeth. Now, every picture of wisdom teeth that I've showed you guys have been clean and white and tooth colored, but these have a little staining. Maybe just take 2 seconds to think about what could be happening with these teeth. So this patient, the staining of the teeth is attributed to lead exposure or tetracycline exposure. Tetracycline used to treat acne. Most of the time when patients are getting treated for acne, you're in the age range where your wisdom teeth are starting to develop. So this kind of goes to show you that everything that you're putting in your body, any medication, anything, it has an effect on your oral health. It has an effect on your teeth. It's all tied together systemically. So while dentists are doctors of the mouth, right, most of the things that are, issues with our body or things that are going on, they manifest in the mouth first. So it shows that the medicines we take affect our bodies in different ways. A lot of things show up in the oral cavity, and that's usually first. So we're talking about AIDS, we're talking about viruses, we're talking about a lot of different things that the oral cancers, a lot of things dentists can identify first in the mouth, whereas if the patient is not going to their primary healthcare physician, they may not be aware of these things. So a lot of times you're kind of telling your patient, hey, you may want to check on this. When was the last time you saw your physician? I'm seeing some things, and, perhaps, you should get these things checked out. So that's one thing that's really important. With sedation dentistry, one of the main things that is that people don't know about that they end up having is sleep apnea. So because the patient has to be hooked up and we have to monitor their oxygen saturation levels, a lot of times we're detecting or we're seeing on their EKGs evidence of sleep apnea, and patients are, we're encouraging them, hey, you should see your physician. You should perhaps get a sleep study so that you can, check that out. And most of the time when the patient comes back, they're like, you know what, thank you for recommending that. I do have sleep apnea. I sleep with a CPAP or whatever, and then their quality of life has significantly improved. So again, dentistry is not just focused on one tooth. It's focused on the whole body because it's the entryway into the body. So I was discussing with the patient at the time, getting their blood checked for elevated lead levels, because that could be a concern. And if the patient had not had tetracycline treatment. Tetracycline has been commonly used to treat acne, and that's what the patient had had. This shows a comprehensive oral care panoramic x-ray. What happened with this patient? She came in, she was terrified of the dentist. I think she was actually a physician. She needed a lot of work. So you can see all of her top teeth or crowns or bridges. And then she had to have some teeth pulled, some teeth root canaled, and some implants placed. She was extremely happy. She could smile again. She was very happy. But this was one case I did for the day, and it was extremely productive. My stress level was extremely low. My patient was happy. I was happy. My assistant was happy. And so our quality of life was really, really high for that day because we were able to provide a service to help a patient, but we also had low stress levels, right? Can you imagine sitting in a chair and you have a needle and you're bringing it to a patient's face and you're so close, they're looking at you and you're looking at them and the assistant's looking and everybody's just sweating, it can be a really stressful time. You'll learn how to manage that in dental school, but still there is a large percentage of the patient population who have high, very, very high dental anxiety. When you provide IV sedation, you kind of almost take that away. So when your patient is not anxious, your doctor is not anxious, your assistant is not anxious, and everybody can perform to their highest level for care. This is also another example of a patient who's had a lot of dental work done. They have lots of fillings. They have some implants there, which are the screw looking things that you guys may not know. In the roots of the teeth that you can see the white substances, those teeth have been treated with root canals. And if there's something that's covering the entire tooth, it's a crown. If it's not covering the entire tooth and it's a white substance, it's a filling. So can you imagine this patient coming every now and then for this work or that work? You know, they're kind of just like, oh, I kind of don't really like this place. Something's always wrong. So again, another benefit of doing IV sedation dentistry. Here, one of the common things in a lot of families is patients that are missing certain teeth congenitally, which means from birth, they don't have certain teeth. This was the case with this patient. Usually it is like the lower second premolars or the upper lateral incisors. So it's a very common thing. Usually the baby tooth is there. It doesn't fall out because there's no tooth to push it out. So it just stays there for a long time and it's kind of out of place because the permanent teeth or the adult teeth are extremely larger than the baby teeth. So sometimes those teeth do resorb and sometimes they don't. They hang around for a longer time because there's no tooth after to push them out. When they do fall out or when the patient's ready to take them out, we will place an implant and the patient has a crown on it. And then it's just like no one knows except for their dentist. So it's also an amazing service to provide for your patients. So I'm from New Orleans. Everything is, you know, who dat, implant that. Hopefully you guys laughed. But at any rate, this is what I was talking about. This patient is missing an anterior tooth here. This is the baby tooth. So usually there will be a tooth that's here that comes in after. There is none here. Okay, this is a lateral incisor. So you can see this baby tooth is just a little tiny bit here. The tooth was loose in the mouth. And we put an implant here. I think I have it on the next slide. Yep, there we go. Just an amazing result for the patient. There, beautiful implant there. This is another case, same situation. The patient was missing lateral incisors. She had beautiful teeth on the other side. She had an implant crown that was just not really that pretty, and it didn't match the treatment that she had on the other side. I think she still had her baby tooth. And this is how she looked. These were her temporary crowns. Obviously, her gums were a little irritated and things like that, but she had a great result. Super happy girl, beautiful. And she got all this work done under IV sedation. So she was very happy with that. This is another case. A patient was she's missing teeth. Obviously you can see she also has like poor oral health and oral hygiene that affected her overall confidence level. It affected just her overall life. And she came in, she wasn't really the nicest person, but can you imagine why she wasn't the nicest person? I mean, you know, she can't smile. She probably feels like she's not happy. You know, a smile is one of the main things that we see with people, right? If you smile at someone and they have a pretty smile, you know, while you're walking, you know, you feel happy. You smile at them and they smile back. Can you imagine smiling at someone and them not smiling back? You're probably like, well, what's wrong with that person? So at any rate, she trusted me long-term. It took a really long time to get her to commit to some work. And this was her smile. I mean, she was a nice girl, but it took her a long time to come out of her shell to be nice. But this is what she ended up with. This was the day of the delivery. Obviously, because her teeth were such misalignment, she didn't focus on keeping her teeth clean. So we had to educate her on how to keep everything clean and nice so her gums wouldn't bleed. She wouldn't have gingivitis. But she had a really amazing result long-term. So she went from this to this, you know, and I mean, just a life-changing thing. This was another patient here. Actually, I think this is another patient. This patient needed a root canal on his tooth. And you always have to do an isolation for rubber dam treatment because the medicines that you're using, you don't want them to go in the rest of the mouth and into the body. Most of the time, the solution that you're using is a form of bleach. It's a diluted form, but we don't want to obviously have any patients swallow that. This is pretty cool. It's a picture of a nerve in the tooth. Most of the time they don't come out like that, but when they do, we are always going to take a picture and show you how it looks, because, you know, once you get into your gross anatomy classes, you'll see the nerves in the body, or you have like human dissections that you'll have to do. But when you see the nerves in the teeth, they're very different. They're kind of like ribbon-like structures that are very small. And this is, you know, when you're doing a root canal, you learn how to do a root canal. You're really using your mind's eye of where you think something is going to be. So when you find it and you can dissect it out and take it out, this is the source of people's pain. When they come in and they have pain from a tooth, they have a toothache. This is what the little devil that is causing their issues. So the tooth on the left is one that does not have root canal treatment. The tooth on the right at the bottom of the screen is one with root canal treatment. When you have a root canal done, you are filling the tooth with a plastic biocompatible material. You're taking the nerve out, which was that cool pictures that I had up there. But it's a molar tooth here. So that's really important to know how to do as a general dentist. This patient was getting some cosmetic work done. Obviously, most of the time when you're doing comprehensive care on a patient and the patient is coming in for IV sedation, that patient generally is not going to have optimal oral health, right? So they're going to have some forms of gingivitis, things like that. So you have to do a lot of things to kind of manage their tissues. They don't really look well. They're swollen, they're bleeding, because there's a lot of bacteria in the environment. This is the patient after they had their work done. Obviously, she still had some anesthesia, but her gums are puffy and bleedy, obviously, because, you know, she's still working on increasing or improving her oral care long-term. This is how some of the appliances come back. This is a bridge for a patient. This is how it comes back from the lab. You can be very specific with the color, the material, the length, the shade, the, characteristics of crowns. You obviously always want it to match on a patient's tooth. This is another picture of a root canal. But I'll go back to that. It's really, they're very beautiful when they come back, you know, so I'll come back and circle back about impressions and talk about why that's very important, because this is what helps you make the great appliances for patients. Here's another picture of a root canal. This is a patient came in, obviously, you know, bad oral hygiene. You can see on the gum tissue, the kind of yellow halo that's around on the gums. That's plaque, which is soft, which you can get off very gently with a toothbrush. But at any rate, this patient needed work done. We replaced the tooth in the front, and he had a really low lip line. We kind of have it pulled up just for picture purposes. But if he was just smiling, you would not be able to know that that's actually a bridge. So that's actually a 3-part piece there. And again, something that I think everyone is providing right now at this point is braces. Yeah, everyone wants a straighter, whiter smile. The misnomer is that it's just cosmetic. But when we think about long-term, when a patient has teeth that are misaligned and they're not able to keep them clean, because if your teeth are not properly lined and one's sticking out here and one's sticking out there, some teeth are going to retain food and bacteria and trap those things. And as we're younger, we have the dexterity in our hands to clean those things properly. But when we get older, it's not that easy. So the older you get, you see more patients that have to get teeth extracted, or they have periodontal disease because their teeth are not aligned properly. So they're harder to clean. So what we tell our patients is that while you're young, you have the means, keep your teeth straight, so that when you're older in life, you can keep those teeth and you can have better resources or better tools to chew your food. This was a younger patient. Her mom was my patient. She was very apprehensive of coming to the dentist. Obviously, you can see why. She just wasn't happy. She wasn't nice. She was just, a lot of times when you meet people and they're not nice or they're not happy, it's generally not anything to do with you and everything to do with what they've experienced in their life. So if you think about when you're treating patients, right, you're actually changing their lives, improving their lives significantly. So there's some impression material way in the back there, but you can see her teeth are significantly worn down. She's got a lot of things going on, needs a lot of crowns, and maybe some root canals, things like that. This is when we removed all the decay, cleaned everything out. If you see a tooth with a hole in it and some redness right in the center there, that means that tooth is needing a root canal. And also that's the nerve of the tooth. So if you go back to thinking about when I said you're using your mind's eye, every single tooth is not the same. So you generally know where things are going to be, but you don't know exactly. So we cleaned everything up, did her root canals, built her teeth up, and then we got some really good impressions. This is what we got back from the lab. These are crowns, full coverage crowns that she needed in her mouth. And this is what the patient looked like afterwards. She was extremely happy. She was extremely like just a completely different person. And she got all of this done, didn't remember any of the drilling, the filling, the injections, the anything. So now she's recommends so many people to the practice. She also is just a different person and is just so happy. So it's improved her quality of life. Her confidence level has significantly increased. So if you can think about wanting to create that change for someone, it's an amazing opportunity to help them out. So she went from broken teeth to beautiful teeth. Here's another case of another patient. He was a construction worker, came into the office. He was having some pain, severe decay. As you can see, he was sedated, and these were his temporary crowns. I don't have a picture of his final restorations, but obviously this is the oxygen, the nasal cannula for the oxygen. But he was able to leave. He came in with this and he was able to leave with this. So even if it's not perfect and these are just his temporary crowns, right? I mean, he's looking way better than what he looked when he walked in. This is another patient. She was having some issues because she has some biting issues. You can see one tooth is darker than the other. Usually when you see the tooth that's darker than the others, that means that tooth is dead. There's no blood supply there. And that tooth needs a root canal at some point to correct it. Sometimes the body will heal itself and do a root canal on the tooth itself, but that's not always the case. And you have to go in and you'd have to do treatment. So when we took everything out and cleaned her up, this is what she had. And then this is how she left when she came in for her final crown. So she went from this to this, and she was extremely happy. She was a sedation patient and just was very, very happy after she left the office. This is another really cool case as a general dentist that you can do. There was no sedation involved here, but this is simply a braces case. You do have to obtain trainings for anything that you are doing outside of the scope of fillings and crowns and root canals, because you want to be in a space where you know that you can provide the same quality of care that an orthodontist would provide. So for this patient to get where we needed to go, we had to obviously take a step back and look at this case. And it goes back to in the beginning when I say you have to have a plan of action when you approach any case. So for this case, to get all of her teeth aligned, there's obviously not enough space. Her jawbone is not big enough for all of her teeth to fit. That is generally the reason why we have crowded teeth, or we have people who need braces. They either have their mom's bones and their dad's teeth, or vice versa. And sometimes if the teeth of one parent is bigger and the other parent is smaller, and you get the mixing of the jawbones and the teeth don't match, then you have to get braces. So that's kind of what happened with this patient. I will give you a second to think of what we did, what we treatment planned, or what we talked about with this patient, how we could treat her. Okay, it wasn't a lot of time, but I know that we are kind of winding down here. I ended up telling the patient, hey, I can get your teeth in line, but we're going to have to take out that one tooth that's sticking out. And she said, okay, fine. I'm totally okay with that. It was hard for her to clean anyway. So this is how we got her canine tooth, which is a tooth that you always want to keep in the mouth. It's one of the longest teeth in the mouth, or and it's like kind of one of the hallmarks or landmarks that you want to keep in your jawbone. So we took out the one incisor. If you can see on the screen, the bottom picture, the tooth that is sticking in, that's the tooth we ended up taking out. You can't really see, her midlines are not lined up, but if you look in the mirror and you smile, no one can see their bottom teeth. So if that tooth, the midlines don't line up, it's totally fine. And she was happy with it. This is another case of aligning the teeth properly so we could do cosmetic treatment on them. So if you don't align the teeth properly and you have teeth that are misaligned or hitting in a spot where they're not supposed to hit, if you put a veneer on a tooth or a crown on the tooth, you end up breaking that. So if you see sometimes when patients have issues with veneers or crowns, most of the time it's because they have some type of alignment that has not maybe been corrected yet. Here's another case. You can see the picture on the left. The patient had a tooth sticking out. We put clear braces on them, tooth color braces. This is an adult patient. He was in braces for about 4 months and got that tooth to tip in and improved his bite, because that's obviously what we want to always do, improve the bite and improve the cleansability of the teeth. And the patient was extremely happy. Same thing here. This patient kept this smile on the left long-term. Can you imagine brushing those teeth as an older person? That would be very challenging. They'll probably be getting food stuck in between those lower teeth and the upper teeth, and it would just end up being a disaster. And as a dentist, when you have a patient who doesn't have teeth that are properly aligned and you're trying to do a filling, it is extremely difficult, because now you have gum tissue that's going to bleed. You're not able to keep anything clean and free from bleeding. And when you're putting in a tooth color filling, you cannot have any bleeding in the area, because if it contaminates your filling and you cure or make that filling material hard in that area, that tooth is going to have a brown looking filling because now it's stained with blood. So this is also, it makes our job easier as well. Same thing. This is a minor case with a patient. Here, this was the patient that was the physician from one of the first slides, and you know how her teeth looked and some things that she needed to get. The blue things that you see on the bottom picture was me opening her bite, so she was not so collapsed and didn't have so much pressure on the areas where she was getting her implants. And I can go back to that slide if you guys need me to. Here is this picture on the left. This is always, like I said, you always want to create a plan of what you're doing so that you don't have to keep everything in your mind. The top is the teeth that we're working on, that we're keeping. The bottom was everything that we're taking out or grafting for a future implant, which you saw that slide earlier, had those implants placed there. These were her crowns and they looked amazing. She was extremely happy. This is another case, but these are the models that you get back from the lab that show you what you will have and how it fits, your preps on the models. This is the same thing, another case, beautiful crowns. Same thing here. You can see this is an implant case. The same thing here. This is a model. This is how everything will look in the mouth. And what do we think this is? If you guess an impression, is exactly correct. It is impression. It comes from the Latin word imprimere, which means to press into or upon or to stamp. If we think about this as it relates to dentistry, it's a mark made on the surface of something by pressing an object onto it. And outside of dentistry, right, it's the imprint that you leave on someone or the impression that you leave on someone. And the goal is always to leave a good impression. It's the foundation that's necessary for success. If you look at this picture here, this is a model that's poured up from an impression. You can clearly see where you want the crown to stop. You can clearly see all of the anatomy that you want. You can create a beautiful crown here. If you didn't have a good impression, you wouldn't be able to do that, and you wouldn't be able to provide a high quality crown for your patient. And long-term success rate of a crown that a patient is trusting you to do will not be good. So you need a good impression for successful crown fabrication. And that's one of the main things we do as general dentists. We do lots of crowns. So you always want to be good with impression, right? Not just in dentistry, but as you guys are matriculating through school to become dentists, you want the ways that you make a good impression is be time. You want to present yourself appropriately every single time. You want to be yourself, because everyone is different. Everyone's not going to be a sedation dentist. Everyone's not going to look like me or talk like me, but you want to be yourself, because you are what makes the world go round. Everyone is different. You want to always have a winning smile. You always want to smile, and you always want to have good body language. Be open and be confident. Use small talk. Try to relate and connect, and not by talking about yourself, but by listening to what others have or what they want to talk about. A lot of times your patients or your professors or your mentors, they want to give you advice, or they want to talk about themselves. When you're interested in someone else, it shows that you care, and you're not just there just because. You always want to be positive, and of course, being courteous and attentive. Some of the keys to success: waking up early, creating a routine, keeping a schedule. Those things will take you through life. You want to set your goals, write them down. If you don't have a place where you write down your goals, you will just keep them maybe in your mind. If you have a great memory, great. But if not, you will just not remember them. They won't be something that's tangible for you. You want to minimize your distractions, and you want to keep track of your success, obviously, because you want to be able to say, you know what? I said I was going to make an A in this class, and you know what? I did it. And that motivates you to do more things. 3 simple rules in life: if you don't go after what you want, you will never have it. If you don't ask, the answer is always no. Always, always. And even if someone tells you no, never be afraid. There's no dumb question. If someone tells you no, you just say, okay, and then you move on. Sometimes that's a redirection or a shift in where you need to be or what you need to do. And if you don't step forward, you're always in the same place. Work hard, be kind, and best wishes, because we don't need luck. That is my dentist in training. And that is my Instagram. So I am open to any questions that anyone has.
Well, first of all, thank you so much, Dr. Monica, for the presentation. It was very exciting to explore cases. And in fact, we have many, many questions to cover. We'll try to get through as many as we can, but we'll go in order. The first one is just a general question for people who are not necessarily as familiar with the path. One student was wondering, how long is dental school, and what would you say are the most covered materials or emphasized materials throughout your training?
Dental school is 4 years, so it's just like medical school. Honestly, for the first 2 years of dental school, it was the exact same classes as the medical students were taking. So it's pretty much the same. You do have to learn about the entire body when you're doing dentistry, and then your last 2 years you're focusing more on like head and neck anatomy. As far as what it contains, mostly, I mean, everything, every part of the body. You have to know all the diseases of the body. You also have to know all the head and neck anatomy and all those diseases, how they manifest, histology, those types of things. So you're really like a head and neck like specialist, right? But you're also have the ability to connect those head and neck issues that you see to the entire body, and how that may be manifesting some other disease of the body. Hopefully that answers the question.
A few more questions as to being a dentist in general. What's the work-life balance for you like? How often do you work? How much time do you make for yourself during the week?
So I am about 11 years out of school. So right now my work-life balance is like amazing. I work generally like 3 days a week, 3 to 4 days a week. When I first got out of school, I was working 5 days a week. Sometimes I was 6 days a week, sometimes 7 days a week if I was on call and had to go into the OR to do jaw surgery with an oral surgeon. Or even after, when I got into private practice, I just really wanted to make sure I had every opportunity that I could possibly have to see more patients, to get better, to have more experiences, to make me a better dentist. So I think when you first get out of school, you should work really, really hard. And then once you get more experience, you can kind of slack off. For me right now, as 10, 11 years out of dental school, I don't work as much. I don't have to work as hard. Now, mind you, I'm doing comprehensive care. So my work week might be less days, but I'm doing cases that kind of encompass everything. So my caseload might be, or my production might be as high as, someone who doesn't offer IV sedation, and maybe it works like more days. So it's kind of a trade-off there. But I do think in dentistry, you can't take it home with you. You can be on call for a patient, but I never feel like there's a true dental emergency. So I think the work-life balance is great. Once you leave the office and you're home, you can't work from home. You can maybe call in a prescription for antibiotics or something like that. But that's it. So when you're in the office, you're in, and when you're out, you are out. And I like that about the dental field. I think it's great for women. I think it's great for everyone because I really believe in the work-life balance. Next question.
Yeah, another question specifically about being in private practice. How easy or difficult is it to get into private practice?
It's pretty easy to be in private practice. When you are in private practice, you do want to take a lot of continuing education classes because usually your fees are higher. If you are in a big net office that is in network with a lot of insurance plans, that's fine, but your patients are paying a higher amount, so you want to provide a higher quality of care. Not that if you are working somewhere else doing public health that you obviously want to do that, right? I just think that it's not hard to be in private practice. I just think that the patients are more maybe more demanding, but they maybe they're more demanding, but it's not a bad place to be. It just depends on what kind of dentistry you want to do. I mean, obviously, because I do sedation dentistry, most of my patients cannot be of the public health sector because a lot of insurances don't pay for sedation dentistry. So patients will have to pay out of pocket. So usually those are cash paying patients who don't have insurance and they just, want to pay for all of their services out of pocket. Dentistry or dental treatment is it's pricey if you are neglecting it. So what you want to encourage your patients to do is come in for their cleanings. And obviously you want to offer ways that they can be successful at preventing decay and needing root canals, crowns, things like that. And one of the ways they do that is by coming into the office every two to three times a year, so that we can maintain a healthy mouth.
And speaking of patient demand, a student asks a question about patient volume. Does that demand carry over to volume? Do you see more volume in private practice?
You do, yeah. So it can be pretty demanding. It just really depends on how fast you can work, what quality of care you can provide. I mean, obviously anybody can go fast, but you want to really provide good fillings, good services that patients can take. And if the service you provide can't last the patient at least 5 years, then you've done a disservice to the patient because now they have to go somewhere else or, go back to you and have something replaced. So I always mark that 5-year should be, whatever you do, it should last at least 5 years. But there's lots of patients everywhere. If you think like everybody needs a dentist, whether they're a baby, an older person, everyone needs to see the dentist. Everyone should be seeing a dentist. So I think that the more the merrier. I think that you really have to click with your patients. I think you really should, relate to them. They should trust you. You should trust them. And if you don't have to treat that patient. I think that's something that a lot of people need to know, that, just because a patient comes into your practice, you don't have to treat them. So if they're not nice or there's something that you don't really connect with them, you can refer them and say, hey, my colleague, I think they're better fit for you, because you want to keep your stress level low as well. I'm not sure if this is currently the situation, but I think dentists had a high suicide rate. And I think that is because, it's a very demanding career. You are solving problems for patients. And so I think anything that you can do to lessen that stress, work-life balance, choosing your patients, choosing your procedures, choosing your cases, making sure you're okay. I think all of those things come into play. And I think that just goes for any field in healthcare.
Earlier as a student, what was the most challenging aspect of getting into dental school?
So it's different. It's different from college, right? It's a different study load. It's a different workload. I mean, you're like, wow, I can study all the stuff, and it's just so much stuff, and it just continues to pile and pile. So I think what I struggle with was trying to figure out how to become a test taker, number one. And I think that's really a big barrier that people run into when they're taking DAT or standardized tests, right? Because now we're thinking about, or we're becoming professional test takers. There's going to be a test the rest of your life at this point. From when you decide you want to go to dental school, you will be tested. You will continue to be tested. So if you can master test taking, which is what I had to figure out how to do. And there's a lot of courses that you can take. Kaplan has courses, there's books on it, there's resources on studentdoctor.net, or that's what it was when I was dental school. But there's a ton of resources. If you can figure out how to take tests, I think that is going to be the main issue. You also have to figure out how to study what works for you. Those are my biggest challenges. And then once I got past that, it was fine. It was smooth sailing. I knew that I needed to write down a schedule. I know I needed to build upon things, that I couldn't wait until like the last minute to like study everything. I knew I needed to look ahead the day before, because I didn't like just being thrown new ideas and not, knowing what their, where the background or where they came from. So I think those were my biggest challenges once I figured that out. And most dental schools, they will have someone on staff or some resource at the school to help you figure those things out. You just have to say, okay, well, like in student services, is there this or is there that? And they have that, they will help you with that. At least Mahari did. So those are really important things, I think, and some of the things that I had struggled with early in going into dental school.
Yeah. And it carries over to having a plan of action, like you mentioned, as a practicing dentist. That was a point you emphasized a lot.
Absolutely. Absolutely. You always have to have a plan.
Definitely. Definitely. Another question we have is about the dental market. So working in dentistry, how competitive is it to have a successful practice?
So there's tons of dentists now. And so you can have an abundance mindset, or you can have a scarcity mindset. And I think what you choose kind of just filters how you're going to approach the market. There's enough patients for everybody, right? What you want to do is be able to provide good quality care to your patients. You want to be caring, you want to be understanding, you want to do things that set you apart, because everybody can do a filling, but that doesn't mean that every patient is going to go to everybody for a filling. So you want to, it's not that you have to market yourself. I think that if you have that abundance mindset, then people will come to you. People will come in to see you. And then if they have a good experience, they'll tell their friends or their coworkers or their family members about who you are. And then you won't really have to market. I don't think there's anything wrong with marketing, but you always want to have your own internal marketing, because that's what really takes your practice and your skill set to the next level. I always tell people the biggest thing that you can do, the biggest way you can repay me, is to tell your friend or family about your experience. If you had a great one, good. If you had a bad one, same thing, good. And give me the feedback so that I can know what things that you didn't like, so that I can improve also. So it's always a learning opportunity. So I think there's the market for everyone. There's enough patients to go around, because there's always somebody being born and they're going to have teeth and they're going to need a cleaning or a filling. They're like, all of our food's processed now. I mean, even fruit has tons of sugar. So there will always be a patient that you can have. So I don't think it will be an issue at all. I think marketing's great. I think you also need to market and brand yourself.
In terms of continuing education, what requirements do you see?
I'm sorry, can you repeat one?
Yeah, no problem. For continuing education, what are the requirements as a dentist?
Okay, yes. So every state is different, but you do have to maintain, I think it's at least 15 to 20 hours every year of continuing education. There's no certain requirement that you have to have as a general dentist. As a sedation dentist, you do have to have the 15 to 20 hours, but you also have to have a certain amount of hours of education in sedation dentistry. And that's usually mandated state to state. It's not the same everywhere, but you do have to maintain that. And then you also have to maintain your CPR or ACLS training. So you are a lifelong learner. There is always continuing education. You have to do it to keep your license current. If you don't do it, a lot of states will kind of let you do it at will and not make you send in the CE certificates. But a lot of them do just random audits, and then you'll have to send in your certificates or the classes that you've done. So you always want to be truthful and honest about that, because they do audit people, and there have been people who have gotten fined or have gotten their licenses suspended for a certain amount of time because they didn't complete those requirements. So that's important for sure. But you also are, improving your skill set. So you don't want to be like the person using the old system and everyone else is using this new system because, you chose not to go to a course or you chose not to invest in yourself, because education, I feel like, is the biggest thing that you can invest in.
Two more questions just to wrap up the end of the hour. These are really two good questions. So I thought to just from the group that we have quite a few questions, so I don't think that we'd be able to get through all of them, but there's two ones that I really wanted to hit on. The first one being, would you say what would you say the proportion of patients is compared to those who come in for necessity and those who come in for cosmetic purposes? What's the ratio?
Well, the ratio would be, I'm really not sure what the ratio is. I think everyone wants cosmetic dentistry. Everyone is not a candidate for cosmetic dentistry. But I do think that cosmetic dentistry is like on trend right now, right? Everyone wants veneers. They want a brighter, wider, bigger smile, which is fine. But one thing to also know is that you should be seeing a licensed dental professional for those services. And most of us, well, all of us, we're not going to put veneers, crowns, those types of things on teeth that have severe decay. So they kind of go hand in hand. If you do want a smile makeover and you do have extensive decay or some things like that, you do have to have those things taken care of before you can have a permanent restoration placed there. But I think on a questionnaire of the patients who come in, and that's every single patient, right? Everybody's gonna mark off that they want a wider smile. So very few patients say that they like their smile. If they like their smile, they've had some cosmetic work done or whitening or something. But I think cosmetic dentistry is really taking off. But with that comes the opportunity to educate the patient on the importance of overall oral health care. That was a good question.
Yeah, it was. And one that I really wanted to end off on, just to cap off today's session, is what do you find the most rewarding part of being a dentist as?
I think I kind of said this earlier. I think as a dentist, I really enjoy being able to help a patient with whatever problem they have. It's extremely gratifying. I'm not guessing at anything. If there's something that's going on with the patient in an area of, let's say, like a right area of their mouth or their face, there's individual testing you can do to figure out which one of those teeth is causing the problem. Based on that, you can identify what's causing the problem. You can treat the problem, and then your patient leaves and you've really solved their problem. A lot of medicine is not like that. I think dentistry is an exact science. If you can figure out the problem, you already know what the answer will be based on what that problem is. I think that's most rewarding, because a lot of times, if you haven't read any articles, there's a lot of times skepticism when it comes into medicine and treating patients. And is this going to help me, or is this medicine going to cause an issue in another part of my body? With dentistry, you don't have that. And I find that most rewarding. I feel like, you're really, helping people become healthier, solving their problem, helping them get out of pain. And it's a really amazing feeling when you can help someone just even with smiling. So, it's also the same way with a patient who's in pain or who has swelling. You're improving their life from the moment you help them, moving forward. So that's what I find most rewarding about a dentist. It does involve being an artist, an engineer, and a scientist. But I think there's, like I said, an art and science to dentistry, and it's an amazing field to go into.
Yeah. Well, I for sure gained a lot of more exposure and definitely an appreciation, interest for cosmetic dentistry. I didn't even imagine it might be like this. And like you said, like myself, I didn't even necessarily think of it this way, but without that realization or without that specific wording, I would never have thought of it as an artist and scientist kind of based combination of a profession. But that is true. It is true. So I think that's a great way to wrap up today's session. Yeah. For our shadowers who are listening in, to earn your attendance, to earn your credit for attendance, I should say, you must pass the quiz to receive a certificate. That quiz is now posted in 2 places. You can find it either in the quiz chat box. So there's a link there. Press on that link. You'll go onto the Google form. And in order to pass the quiz, you'll need 60% or higher. It's also posted on our website under the virtual shadowing page. If you click onto that page and then scroll a little down, you'll see shadowing quiz, Dr. Wheeler. That quiz will be due at 11:59 p.m. Central Standard Time on this upcoming Sunday, August 14th. After passing that quiz, like I said, with 60% or above, you'll be sent a certificate to the inbox of the email address you list on the quiz. Just in case you don't find that certificate, feel free to email us or check your spam folder ahead of time. Sometimes it lands there. For our next shadowing session, we're going to be joined by Dr. Chavinsky for preventative and lifestyle medicine this Thursday, August 11th at 7 p.m. Central. If you aren't already familiar with our schedule, we do usually have Mondays and Thursdays as our shadowing schedule, usually starting at the same time. So you can more or less rely on us being there Mondays and Thursdays at 7 p.m. Central, although stay tuned on our Instagram page or listserv for any changes that are made. Sometimes we might have some sessions that are different, and also just to get to know the speakers and specialties you will see. Other than that, that's all. Dr. Monica shared her Instagram handle, so if you want to get in contact with her there, feel free. But I think that's all for now. Thank you so much again, Dr. Monica, for joining us. It was a pleasure, and it was great to see a new side of dentistry. So far, we've covered periodontics and pediatric dentistry. So this is our 3rd dental session, I think. It's a new side of dentistry, and I hope all the students here enjoyed. But thank you again.
Yes, thank you for having me. And guys, just send me a message if you have any questions or you need any help with anything. I'm happy to help.